Hey guys, welcome back to the Spinal Hygiene Series 2.0. I'm Dr. Norris Goldberg, owner and clinical director here at Koru Chiropractic in Louisville, Colorado. And for this week, week 2, I want to talk to you about stress, okay? A lot of people do not want to talk about their stress. I'm not trying to have a therapy session here. I'm not trying to dive into our deepest darkest corners of our our psyche and our past traumas, but here's what I find as a chiropractor. A lot of people have uncontrolled stress. I would say, in fact, the majority of people. So if you're watching this video, it's very likely that you do indeed struggle with stress management and ultimately allow stress to do things to your body that you wish it wasn't doing, right? So whether that's losing sleep, poor digestion, mental health struggles with anxiety and depression because of chronic stress, this is something this video actually can help you. And what I'm getting at is, how is stress actually affecting your spine? How is this going to affect your results in this practice? And how can we get you better results down the road on top of the corrective care adjustments that you're getting here at Koru? So real quick, the first thing you have to really understand about stress is just the way our bodies are wired, right? We are wired, a lot of people have heard this analogy before, to, like cavemen, right? We're aware and fearful of things like the saber-toothed tiger. But when that saber-toothed tiger is not a threat to us, our bodies should be in a rested and relaxed state where things, digest easily, our body heals easily, and our inflammation is low. But if stress is high, inflammation's high, our immune system might work well in terms of trying to kind of fight off some sickness, but we're not great long-term healers. And we carry a lot of tension and energy in the body because we're ready for a fight or a flight or even freeze, right? So the thing is, we need to break our bodies out of this fight or flight cycle, because if we're constantly stuck in the sympathetic dominant state that I find most people are when they come into this practice, and we actually use that objective testing. Remember when you put your hand on the little like palm reader type thing, that's the heart rate variability, that's a stress test. And if you're on the left side of the graph there's a good chance, actually I shouldn't say there's a good chance, you are sympathetically dominant, meaning your body is in the fight or flight stage at the moment we do that assessment. And if it's down in the orange or red, it means that you're chronically like that. It's actually having a long-term effect on the nervous system and ultimately on your health, okay? So again, most people are sympathetic dominant. This video is for you if you are. Most people who are saying they don't have stress actually are the most stressed. So I don't want to call anyone out, but if you're saying I don't have stress, unless you're a special unicorn and maybe you're just blessed with abundance and you don't have a job or you don't need a job, like if you have a job, if you have a family, if you're on social media, if you watch the news at all, you have stress. Okay, it doesn't matter if you're left, right, red, blue, up, down, black, white. It really doesn't matter. We all struggle with stress. So that's why I'm emphasizing this to you, because I really want you to understand, the sooner you accept that you have stress and that you need to counteract stress, the sooner you're on the path to recovery. Okay, thanks for coming to my TED Talk. Just kidding. Seriously, I had to get that out of the way. If you just really need to address stress, it really affects the spine, and it's going to affect your posture. Okay, so I might make a whole nother video for that, but right now, let's just talk about breath work. How can we help you in a simple way get your body into a more relaxed state, and also make sure that we're not making the tension in your body negatively affect your spine. So in this case, a lot of it has to do with your neck, but it also can affect your low back. So a lot of people, when you're stressed, think about a situation where you really are surviving, right? Maybe you're running away from a cougar or a grizzly bear, and as you're running away, like, you're breathing really big, right? Your peripheral vision, you can see everything. Actually, it's more like tunnel vision. You just need to be able to run straight ahead. You don't care if there's birds flying around. You're just wondering, is that bear right in front of me or behind me? And I gotta get away, right? Maybe you're sweating easier. You're breathing more shallowly and more rapidly. The reason we really need to address breath is that breath can affect your spine, all right? And so it can affect, for sure, your neck and potentially your mid and low back. A lot of us, when we're in these stress cycles, and we don't even notice it because we're, quite honestly, they're so constantly and consistently that it's pretty hard to really feel relaxed other than just passing out in the middle of the night because you're exhausted. Okay, So that's a lot of people's life cycle, is wake up, within a few minutes start feeling stressed and anxious, go through the whole day, crash at the end of the night, pure exhaustion, and then wake up and do it all over again. We're not really getting our bodies into these deeper relaxation and recovery modes. So one of the best times to do breath work is in the evening or the afternoon, or really any time of day you're feeling high stress and anxiety. But the thing is, when we're doing stressed breathing, we're actually using a lot of secondary breathing muscles. So our primary breathing muscle is the diaphragm right here, right? And a lot of us have, been to like one of those kids' science museums. When the diaphragm contracts, it actually tightens, it flattens here, it creates a negative vacuum pressure that fills those balloons. That's the air coming into our lungs. And then as the pressure changes, as the diaphragm relaxes, it pushes the air out of our lungs. So you get rid of the CO2 and then bring fresh O2 back into our body, right? So won't get any further into that. But what we want to do, let's say we're running from that grizzly bear, right? And the bear's chasing us. Well, we want to get extra oxygen into our body so we can run for a really long time. And the way we do that is we're not just using our diaphragm going up and down, we're also using what we call our accessory muscles. So these muscles that are, in between our ribs, also connected to our ribs from our neck and our shoulders. And what we're doing is we're breathing really intense, really high up, right? So we're getting a lot of tension through this area here. And so I get a lot of people, a lot of both men and women who come in who are extremely stressed. They're stuck in these fight or flight responses, and they just have bricks in their shoulders right here and right here, okay? They'll also have really stringy neck muscles through between the collarbone and the shoulder. We call this the anterior triangle right here. It'll feel really ropey and stringy because you're using those muscles constantly and they're never really getting a break. On the opposite side of things, what I'll notice is people who are stressed breathing are not really belly breathing. So when they lay down, and I'm gonna show you an example of this in a minute, when they're laying down, there's no rise or fall of their stomach. The motion is all just happening in their neck and shoulders here. And so what happens is you get tighter and tighter here. You actually get weak in your diaphragm, and ultimately that's going to affect your core, which could affect your low back and your mid back. So let's actually get to the exercise now. A lot of us have done breath work, but if you haven't, this is the point where I want you to pay really close attention, okay? All right, so when I'm practicing my breath work, you can do this seated, but I'm gonna show you laying down just so you can kind of see what's happening throughout my body here. I like to put one hand right above my belly button here, kind of like right on the soft spot of your belly. And I'll usually put another hand kind of like right over my collarbones with my thumb and my index. So I can just feel if there's a lot of motion happening there. So these two hands, they're just gonna be feeling what's happening as I'm breathing, all right? Ideally, what we really wanna do to get the best relaxation breath is do short inhales with long exhales. So ideally we get to a place where maybe we're inhaling for 3 seconds, but even exhaling up to 9 seconds. And that means you're really only gonna breathe about 4 times in a minute, which is about 1/3 as much as you normally do. And that's actually gonna allow our body to relax, believe it or not. So really give this a go if you haven't tried this earnestly. I'm gonna do a 3-second inhale through my nose. And that was a 9-second exhale out my nose. Some people inhale through the nose and then exhale out the mouth. I prefer in the nose, out the nose, but definitely always in the nose, okay? And so as we're inhaling there, what I'm feeling is, which hand is moving? This one moved a lot. This one, I felt a little bit of motion, but it wasn't a lot of motion. If I make that feel exaggerated, it was probably a little bit more here, certainly 50-50. I'm gonna do a relaxation breath again. There's almost no motion here, just kind of very subtle. I felt like my shirt was sliding under my hand a little bit. This felt about 95% of the motion, right? It was my stomach or my belly coming up. I don't necessarily want to do a hard exhale, but I want to exhale enough that I'm really getting it all the way out my lungs, feeling like a full, complete cycle. Even though it's taking longer to exhale, I'm not just counting and sort of holding my breath. I want to really push it all the way out. It doesn't have to be an exertion. It should feel very passive, but delayed, long, long exhale. The reason we do that that long exhale is going to get us into that more relaxed state. Again, you can do this seated. You can sit right here. I've got my other hand right on my belly. I feel a little expansion in my ribs. It kind of happens after my stomach starts moving, and my stomach or my belly really moves about 90% of the effort, right? So this is just very, very subtle. If you feel like a lot of motion, big chest lift happening, we got to fix that breathing, okay? Now, there's going to be two more things I want to share with you. First of all is if you want to learn more about this, you should read the book called Breathe. Breathe is an excellent book. Really talks about different breathing modalities, different tempos of breathing, box breathing, kind of like Wim Hof style breathing, the breathing that I just described with short inhales and long exhales. And one breath work that is not in that book, but is very well researched, kind of came out after the book was published, is the physiological sigh or the double sip inhale, okay? And so this is also a very effective way, proven through research, to get your body into a more relaxed parasympathetic state and out of that fight or flight state, all right? So for some people, maybe they don't want to do the long exhales, so you can just do this little inhale trick, and for whatever reason, it works. I can get into the explanation. It has to do with your O2 and CO2 ratios, but we'll keep it simple for today, okay? So the double sip inhale or physiological sigh is what we do here. It's going to be an inhale. At the end, one more. It's kind of like a little sniff, and then and you really almost want to sigh. You want to really let that out to full completion. So just like my long breath cycle where I'm doing a long exhale and I want to breathe out the whole time, with this, it's going to come out a lot faster, but I want it all out. I want you to dump it, okay? Big sigh, make an audible noise, all right? So, now I know you can see that last little sip. That does require my accessory muscles. So yeah, if we breathe like this all the time, it'd probably not be great for our neck. But for hacking our nervous system and our physiology to get us to relax quicker, I think it's worth the trade-off, okay? So again, big physiological sigh. That's why it's called the physiological sigh. Or again, double sip inhale. Give that a go. Usually if you do it, honestly, even 2 or 3 times, I'm already feeling relaxed doing it right there. A couple minutes a day goes a long way, especially when you're transitioning from maybe that more stressful state, whether it's like school or work, whatever it is, whatever's getting you stressed, trying to get into that more relaxed state before bed. This is a great exercise to do during your wind down routine. You can also do it at other stressful points of the day. Hope you enjoy that, and looking forward to sharing more about your spinal hygiene and how we can get you better results here at Koru Chiropractic.